Dr. Chen, like in your practice, in medical practice where you're using red light, what are the frequencies, durations? Do you give patients a break of a few months if they've done a course of them? I mean, how do you normally approach it?
So again, this is very individualized treatment plan. So it depends on what it is they're treating. We've had quite a few people who have come through with long COVID or chronic fatigue syndrome, and they have really found it beneficial to use the whole body red light treatment for 2 or 3 times a week for a few weeks. And then they start to notice really good improvements. And then quite often they will naturally give it a break. I think it's different when you're paying for a treatment versus having a device at home.
Yeah.
So if you are paying for a treatment, then people tend to pay for the treatment for as long as it's as long as needed for them to see the result, and then they tend to stop for a while because then they feel like they don't need to pay for any more for a while. So we've had a couple of long COVID patients who have had a course of 10 treatments over a few weeks. Then they will have a break for a few months, and they do find the results do tend to last for a while. And then when they feel like they need a boost, they'll come back and they'll have another course of treatment. Very recently had a client with rheumatoid arthritis. She's quite young and she had rheumatoid arthritis. She was on medication, and she went to this health summit, heard about red light therapy, and she found us. She wanted to try red light therapy. So she signed up to our monthly subscription, unlimited, so she could come as much as possible. She sort of came about 4 times a week. And when she started red light therapy, she just came off all her medications. I didn't tell her to do that. She just decided to do that. Stopped taking all her medications for rheumatoid arthritis. And she did it for a month, and she did not need to go on her medication at all. It was controlling her symptoms. And so she then went on for another month, and again, didn't have to go back to the medications. And it's been really effective and quite life-changing for her to not needing those medications.
Yeah.
I know this is only one case study, but she heard this being talked about at this health summit. So obviously there are other similar cases.
Yeah.
It's really encouraging, and it just makes me as a doctor think, if this sort of much safer, natural way of treating arthritis works, why aren't we using more of it?